Hello, everybody. My name is Jack. I'm an agent at Summit Independent Insurance Services. And today we just want to do a quick video to go over the Medicare Part D coverage gap, otherwise known as the donut hole. Now, this is just going to be a short video going through just the basic information about the coverage gap, what it is, how to avoid it. If you want more information, visit our website, or you can give us a call and we can go over it with you in detail. Just wanted to kind of put a video out there because this time of year is when people are starting to get into that coverage gap. So if you're wondering about how this is going to affect you, we just wanted to talk a little bit about it today. So without further ado, let's get into it. Okay. We'll start with the Medicare Part D overview. So for those of you that don't know, the Medicare Part D is going to be your prescription drug coverage. So this is going to help you have access to the medications that you need. You're going to pay a monthly premium as well as some co-payments on certain medications. And in return, this plan will subsidize your prescription medications. Now, the details of these plans, whether it be what drugs they cover, the costs, and the pharmacy networks, that changes year to year. So it's very important that during your annual enrollment period, or AEP, that you go ahead and you shop your plan. That's from October 15th to December 7th. So in that time window, it is crucial that you make sure that you're on the best plan possible. And we'll get into kind of why that is important in the next couple of slides. Understanding the Medicare Part D coverage gap. During the coverage gap, you're going to pay 25% of your prescription drug costs, which is a lot depending on which prescription drugs that you're taking. So it's definitely best to try to avoid the coverage gap if possible. But if you're taking a lot of medications or expensive medications, it's sometimes unavoidable. And the coverage gap starts when you spend $4,660 and it ends and you go into what they call catastrophic coverage after you've spent $7,400. And that's you and your plan. So that's kind of when you get into it and when you're going to get out of it. Those are important numbers to keep in mind, and you'll be able to predict when you can get in and when you're going to get out of this. During your AEP, when you shop your plan, there is a way to predict when you're going to enter the coverage gap and when you will exit it. So it's important to know that so you can avoid any sort of unexpected medical bills. All right, well, here's how to avoid it. You could choose the right plan during AEP. Now, this is the most crucial thing. So because things change during the year, just because the plan that you were on last year worked for you last year doesn't mean it's going to work for you this year. So you really do want to shop your plan every year and find the cheapest plan, right? Because the more money you spend, the more likely you're going to be in the coverage gap. So finding that cheapest plan is going to help you avoid the coverage gap more than anything else, okay? And the next thing that you can do is you could just try to keep costs as low as possible. Now, there's kind of three ways that we've pointed out that you can do that. You could go for generic drugs, which are going to be cheaper. You could go to a mail order or preferred pharmacy. So each of these plans, they have a preferred pharmacy network. And what that means is those are going to be the cheapest pharmacies to go to. So you want to make sure you're going to those pharmacies. And you can also get your prescriptions in a 3-month supply. And doing these three things, that's going to bring the price down on your prescription drugs and therefore help you avoid the coverage gap. And if you have limited income, there are extra help programs. We'll probably do a separate video on that. But just know that if you're struggling financially, you can get extra help. All right, let's just wrap it up here. You want to understand how long you're going to be in the coverage gap. And the best time to look at that is during your annual enrollment period. And that will just set you up for the year and give you a good understanding of the costs that you're looking at for the entire year. And that way you don't have any unexpected expenses, especially if you're on a fixed income. And you want to enroll in the most cost-effective plan during AEP, right? The name of the game is to not break that number and not enter the coverage gap. So enroll in the most cost-effective plan, and that will kind of help you avoid it if possible. And then you want to keep costs as low as possible by going to preferred pharmacies and using generic drugs when you can. Again, guys, the name of the game, it really is just to keep your costs down as much as possible, because once you enter that coverage gap, you have to spend quite a bit to get out of it. So, and you have that 25% coinsurance when you're in there. So it's not a great place to be. It is unavoidable for some people. And, there's ways to kind of navigate that, but at all costs, you're going to want to try to avoid it if possible. And that was just a short presentation about the coverage gap. If you have any more detailed questions, visit our website or give us a call. We'd be happy to go over everything with you in detail and tailor some information to your specific situation. So if that is enticing, go ahead and give us a call, and we look forward to speaking with you. Thank you.